Canada is implementing new health guidelines when it comes to drinking alcohol. The recommendation says that Canadians limit themselves to 2 drinks a week, or ideally cut out alcohol altogether, saying that moderate drinking can pose a number of serious health risks. Our 9 health expert, Dr. Payal Kohli, is joining us now. And first of all, Canada revised their guidelines literally yesterday. We did a story on saying that moderate alcohol reduces your risk of dementia.
Well, let's be clear. Moderate alcohol doesn't reduce your risk. It's associated with a lower risk.
Okay, see, we knew there was more to that story.
It could be a marker for other healthful behaviors. For example, the study that you're talking about came out of Korea. So in Korea, if you're able to access a couple of glasses of alcohol a day, you're probably in a socio-demographic status that's a little bit better. So it could be a marker for wealth. It could be a marker for access to medical care, something else. But alcohol itself, it's quite clear, is not good for our brain health and our body's health.
Well, tell us about the Canadian study then, or at least what their recommendations are becoming.
Yeah, the guidelines have done a 180, and it's really turned the whole medical community on its head, because we're wondering if we should be doing the same thing here in the U.S. So they used to have 10 to 15 drinks a week as the sort of safe, moderate drinking limit. Now they've taken that down to 2, because you can see there's a dose-dependent relationship between alcohol and risk. So any more than 2, meaning 3 to 6, increased risk for cancer. And then when you're getting into more than 7 a week, not a day, but a week, you're talking about significantly, exponentially increased risk for heart disease, stroke, and cancer.
This is just guidance. It's not a rule or anything in Canada. But when you go from 10 to 15 to 2, that's a significant change.
Yes, it is.
It's a significant change, but it's a long time coming. And it's time we woke up here in the U.S. and take note of the emerging medical literature, because what we've been holding on to with what we had here in the U.S., which was 7 for women, 1 drink a day for women and 2 drinks a day for men, so 7 to 14 drinks a week, that's historical artifact. That's based on old studies from decades ago where we thought it wasn't as bad for us as it actually turns out to be.
Yeah, well, I mean, we always have to fill that out when you go to the doctor. How do you drink? How much do you drink? And you always wonder, well, why does it matter that much?
What does happen with that?
What does happen with that information?
Well, a lot of different things. So at the doctors, we're talking not just about our health risks, but also medication interactions. So are there medicines you might be taking that could be affecting? We also look at how much you drink as part of your overall behavior. And especially after the COVID-19 pandemic, we have seen increases in those numbers go up. And my problem is it's become a social norm. What do we do when we go out on weekends? We meet friends for drinks. What do we do when we try to relax? We drink. We have to turn that culture different so that we're now thinking non-alcoholic choices. We're thinking water. We're thinking other ways to socialize that doesn't involve alcohol.
It seems like it's going to be a difficult push. The sociological component of that, you're talking about a cultural shift. You hate to use broad brush stereotypes, but Canadians are famous, for having a few Molsons, going to the curling match, going to the hockey game, and it's part of culture there.
It is part of culture, but the Canadian guidelines are much more in alignment with other countries, even European countries, where the stereotype is that they drink a lot. But in the UK, for example, it's 6 drinks a week. So here in the United States at 7 to 14, that is off the charts high. And we're misrepresenting the health risks of alcohol by leaving it at that. So I think this is going to be a wake-up call for other countries, US especially, which kind of leads the charge in the high number of drinks that we say are okay, to really start to think again about what's safe when it comes to alcohol.
One thing I've learned over the past 2 or 3 years is that Americans like being told by the medical community what to do.
That's what I was just going to say.
And I'm sure this is going to make me wildly popular to tell everyone that they should drink less than 2. But
those are the facts. That's the medical analysis.
And here's what I would say. If you want to drink 4 a week, it is better to drink 1 every day for 4 days than it is to be a weekend warrior and do 4 on Friday or 4 on Saturday, because it's the effective dose of alcohol that your body has to metabolize and sort of break down when you're doing that on the weekend.
And that number's big too. Don't you think also for 250-pound people and 112-pound people that's going to be a very different
4 drinks
number.
is a lot.
Certainly, of course. And it's variable if you're a man or woman, because the volume of your body is different size. So the amount of distribution that the drug has is different. How much you drink at baseline, whether you work in the morning or at night, whether you use other medications that could interfere, those all impact your risk. But I think it's just time for every American to wake up, ask themselves critically what they're doing with their alcohol consumption, why they're doing it, and whether they should continue or try to cut back.
Yeah, if nothing else, I mean, none of us like to be told what we should do, but if we're talking about it, maybe we can do it, and do it amongst our friends, make it part of the social norm.
Yes, so you meet your friends for a walk in the park or coffee or something else, a mocktail.
Positive, yeah.
Yes, rather than necessarily the alcohol-centered behavior.
See what that impact has from those to our north. Thanks as always, Dr. Payal Kohli visiting with us today.